All right, so we're going to talk about humor therapy. What is it and how does it work? Well, humor therapy is a complementary therapy that can either work alongside with conventional medicine or by itself. It has been found to help chronic pain and increase one's well being through various means such as games, movies, TV shows, and laughing exercises. Studies have found that the use of clowns or doctors that dress as clowns help reduce anxiety in children pre-operation. Physiological changes that can be seen with laughter are increases in immune-fighting antibodies, increases in endorphins, increases lung capacity, increases abdominal strength, and also decreases stress hormones such as cortisol, growth hormone, and epinephrine. History, so humor has basically been around since we've been around. It is a Latin word, and it means fluid or moisture. So during the medieval period in Europe, bodily fluids or humor were associated with different types of moods. So a yellow bile would be associated with melancholy and being depressed. Black bile would be associated with anger and hostility. Blood would be happy and a cheerful spirit. And then lastly, phlegm would be associated with apathy and sluggishness. So if a person had too much or produced too much of one of these biles, it created a mood change, allegedly. And it would subject that individual to social ridicule and essentially the first comedians. A balanced fluid meant that the individual was in good humor. In the Middle Ages in Europe and in the eastern portions of the United States, Christians believed laughter was an act of the devil. So if anyone was seen laughing out loud, people would assume that person was possessed. So for hundreds of years, people wouldn't smile in portraits because of this. Norman Cousins, who is a huge reason why humor therapy is legitimized by the medical community, is a person who had a rare disease and ended up using humor therapy as an intervention on himself, which helped fight his disease and actually put his disease into remission. So for the first findings of my research, I did humor therapy for older adults. So the purpose of this study, it was to examine humor therapy and relieving pain and increasing overall well-being in older adults. So the method, it was a quasi-experimental post-test. They invited 2 nursing homes to participate in this 8-week program. The experimental group had 36 subjects, and they created a portfolio which included many different things from funny articles, movies, jokes, and then they would view this portfolio once a week alongside with lectures on humor therapy as well as exercises. The control group received no intervention. After the 8-week intervention, post questionnaires were filled out by both groups, and the experimental group gave feedback about the humor therapy. So the results of this study, the experimental group showed significant decreases in pain and loneliness scores compared to the controls. And also the experimental group showed significant increases in happiness and life satisfaction compared to the controls. For the second research article I found, it was on laughter therapy for postpartum women. And the purpose of it was to examine the effects of the immune response, specifically an immunoglobulin, SIGA, which is found in breast milk, in postpartum women after laughter therapy. So the methods for this it was a convenient sample of 78 women who were postpartum. There were 38 in the experimental group and then 38 in the control. The experimental group participated in 60-minute sessions twice a week for 2 weeks. And then the breast milk was measured to evaluate the SIGA levels. The findings of this experiment, significant differences between groups. So the experimental group had less of a decrease in SIGA, indicating higher levels of antibodies compared to the controls. So to wrap this all up with the summary and the conclusion, humor therapy has been around for thousands of years to help heal the mind, body, and soul. Humor therapy has been shown to help decrease pain, improve lung and abdominal strength, increase antibodies, and decrease stress hormones. Studies have shown that implementing humor therapy in older adult lives help decrease their chronic pain and increase their overall happiness. And then lastly, making laughter therapy part of the post-care for postpartum women has been shown to help slow the decrease of antibodies in breast milk. So to implement humor therapy into your guys' lives, I found a TEDx that's roughly about 5 minutes. You click on this link here, and it's actually laughter yoga. So I hope you guys enjoy, and I hope it helps. And then here are my references, and that's it.